The runners-up for the Democratic and Republican nominations for president in their first debate, Senator Bernie Sanders, independent of Vermont. And Senator Ted Cruz, Republican of Texas.
Cruz?
Well, Jake, I think the question you asked is a very good one, and you're right that choices have gone down dramatically. Indeed, I don't know if the cameras can see this, but in 70% of the counties in America, on Obamacare exchanges, you have a choice of 1 or 2 health insurance plans. That's it. 70% of the counties in America. It's interesting. You look at this map, this also very much looks like the electoral map that elected Donald Trump. It's really quite striking that the communities that have been hammered by this disaster of a law said enough already. Now, Bernie likes talking about a public option. That's another way of saying government control of your health care. It's socialized medicine, and what does it mean? Every country where it's been applied, you've seen rationing, you've seen government deciding, especially seniors. Seniors, you don't get the health care you need. Now, Bernie mentions Canada quite a bit. I know quite a bit about Canadian health care. I was born there. You know, Bernie, that may be the best argument against your position is you know, look what it produced.
Look at the results. Yeah, that's right.
But, you know, people vote with their feet. In 2014, over 52,000 Canadians left Canada to get health care in the United States and other countries. I'm reminded of a comment Ronald Reagan used to say about East Berlin, about the Berlin Wall. He said, the funny thing the leftists never seem to notice, the machine guns all point one direction. Everyone was fleeing communism and coming to freedom. If you look at socialized medicine, people leave their tens and hundreds of thousands every year, leave socialized medicine countries because they want to get a hip replacement, a knee replacement. You know, the governor of one of the Canadian provinces came to America to get heart surgery, and he was a governor in Canada. And by the way, in your home state of Vermont, your hospitals advertise with Canadian flags, come to American hospitals, you'll get better health care. I don't want to mess up our health care. I want patients, all of us, to be in charge of our health care, not government deciding what. See, Bernie, you say wasteful, and I say people exercising free choice. You're right. We could cut costs here if we do like Europe and cut the number of MRIs, the number of mammograms. If we cut, you know, you look at the elderly in much of Europe. The elderly here, when the elderly face life-threatening diseases, they're often treated in the intensive care unit. In Europe, they're often put in palliative care, essentially doped up with some drugs and said, well, now is your time to go.
Oh.
I don't expect the government to be saying that. And let me give, since you laughed at that, let's actually talk facts, because facts matter. Yeah. So let's talk about, for example, a couple of stories from the United Kingdom. In Glasgow, Scotland, the Queen Elizabeth University Hospital was so overburdened this past January, it turned away 3 women who were in labor because they couldn't take care of them. In Worcester, England, a man was left on an ambulance gurney for 5 hours before his heart attack was diagnosed. And he waited 7 hours before he received a stent and angioplasty. In a hospital in Essex, doctors twice canceled a potential life-saving surgery for a patient with esophageal cancer because there were no free beds in the intensive care unit. One more example in Wales. An 82-year-old woman who had fallen waited 8 hours on the floor before an ambulance arrived. Her daughter sat beside her in the ordeal, described it as one of the longest nights of our life. This is what happened when government takes over health care. Every example on earth. The result is rationing and waiting periods, and you, the citizens, being told, no, you can't have the health care you want and deserve.
And you're right. This is a good discussion. All right. And here is the issue. Ted, let me ask you a question.
Sure.
Is every American entitled, and I underlined that word, to health care as a right of being an American? Yes or no?
You know, I'm glad you asked that. You know, right is a word you use a lot. Let's talk about what rights are. Rights mean you have a right for government not to mess with you, for government not to do things with you. If you look at the Bill of Rights, free speech means the government can't silence you when you're speaking. Religious liberty means the government can't control who you worship, what your faith is. The Second Amendment means the government can't take away your guns. Those are rights. You know what the Declaration of Independence said? We hold these truths to be self-evident, that all men are created equal and that they are endowed by their Creator with certain unalienable rights, that among these are life, liberty, and the pursuit of happiness. So what is a right? Is access to health care. What is a right is choosing your own doctor. And if you believe health care is a right, why on earth did you help write Obamacare that caused 6 million people to have their health insurance canceled, that had them lose their doctors, and have people like LaRonda who can't get health insurance, can't afford premiums? You're denying her what you say is her right. Defining people. But let me make a broader point on taxes, which is many times in this debate, Bernie has talked about providing health care for free from the government. You know what? The simplest principle in economics is Tonstoffel. There ain't no such thing as a free lunch. The liberal-leaning Urban Institute scored Bernie's health plan, concluded it would cost $2.5 trillion in the first year and $32 trillion over 10 years. Now, how much is that? Trillions is a big number. It's not clear what that is. Let me put it in perspective. All of the federal income taxes we pay today are about $1.5 trillion a year. $2.5 trillion means every one of us paying income taxes would have to about triple what you pay in income taxes to get an additional $2.5 trillion. Now, Bernie, no doubt, is going to come back and say, no, 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 no. None of you are going to pay. Just the rich. Well, how about if we took every person that makes over $1 million a year and confiscated 100% of their income, took every penny that they make? That would raise only enough money to fund Bernie's plan for 5 months. Here's another idea. How about if the government confiscated the assets of Apple, Google, Microsoft, Facebook, and ExxonMobil? If it came in, illegally seized those companies and sold them, that would pay for 1 year of Bernie's plan. If you don't want to see your taxes triple, in addition to the wait list, in addition to the rationing, in addition to fewer MRIs and mammograms, to worse care, then you don't want to see Bernie's Medicaid for all. You want to see cheap, affordable health care that you can choose, that puts you in control. You know, I'd like to take a minute and actually ask the people here, if the cameras could turn for a moment to the folks in the audience. I want to ask you, how many of you here in the last 6 years have seen your health insurance premiums or your deductibles go up? Let me ask another question. How many of you here know somebody, including yourself, who's had your insurance policy canceled in the last 6 years? If you look at these hands across the room, this is why people are so unhappy with Obamacare. Because it isn't working. Because it was built on an edifice of lies. When politicians promise the American people, if you like your plan, you can keep your plan. If you like your doctor, you can keep your doctor. And 6 million people get their plans canceled against their wishes. Those are broken promises. When the President of the United States promises your premiums will drop $2,500 and instead the average premium rises $5,000 and deductibles go up $5,000, people are hurting because of Obamacare. And Bernie's solution, you know, I'm reminded of an old Saturday Night Live skit with Christopher Walken, where they're playing in a band and he keeps ringing the cowbell. And every time they record it, his solution is more cowbell, more cowbell. It was government control that messed this all up. And Bernie and the Democrats' solution is more cowbell, more cowbell. Yeah, it didn't work when we said you wouldn't get your plan canceled. Yeah, it didn't work when we said your premiums would be cut. But give government even more power. We can do better. I believe we're going to honor the promises we made to the American people, and we're going to repeal what Bill Clinton called Obamacare the craziest law in the world. Instead, we're going to give you choice, let you buy insurance across state lines, expand health savings account, make insurance portable, block grant Medicaid to the states so you can have experimentation health savings accounts so we can meet your needs, put you in charge of your health care with your doctor, not government. That's what this election was about, and now it is incumbent on all of us, Republicans and Democrats, to deliver on the promises made to the American people.